Hello and welcome to another edition of For the Record. I'm Sean Murphy. Today, a very serious subject, synthetic drugs. A lot of drugs you may have never heard of before. We brought in the chairman of emergency medicine at L&M Hospital. His name is Dr. Mayorga. Did I say that right?
Yes.
Welcome to the show for the first time.
Thanks for having me.
For those who aren't familiar, and I'm one of them, what are synthetic drugs?
So synthetic drugs are actually made in a laboratory. They're not the usual things you're used to, like marijuana or heroin or even cocaine.
So it's nothing grown.
Nothing grown, and actually just very different in the sense that they come in different varieties. Nobody really knows what they do to you, and actually they start as chemical compounds in some lab that honestly a lot of people don't know where they come from. Some people say China, some say somewhere in Europe, but what they do is they sprinkle the chemical onto a plant-based substance, and then that is either generally smoked, sometimes it's eaten, and it causes all sorts of side effects that nobody understands.
Why did somebody somewhere decide that synthetic drugs, that there was a need for it? Is it a financial thing? Is it just like an alternative, or what is it exactly?
You know, that's a tricky question. I got to say it's probably cheaper than the usual drugs, easily accessible, and technically not illegal in a lot of places until recently. Yeah. So, you know, you can outlaw a specific chemical compound. The government can do that, and you can charge somebody with, you know, having an illegal substance. But for something that just has a slight tweak in the chemical compound, technically, it's not illegal. And until recently, law enforcement has just been trying to catch up to the illegal compounds, but then the chemist can change the compound the very next day.
So just changing the chemistry of it, you know, somehow, some way changes in reality what it is, and hence it's not the same thing anymore. Hence, according to your definition, law enforcement, it's not illegal.
Correct.
Wow.
And that one little change can drastically alter what it does to you as a person using it. And so that's really the danger here is, you know, for many years we know what marijuana does to you. We know what alcohol does to you. We know what heroin does to you, frankly. We don't know what these synthetic cannabinoids, that's what they're called. They're with some relation to weed, marijuana, but also very different in what they do to you. So
Now when you say you don't know what they do, however, I would assume that they're designed to have a similar effect to the drug that they're emulating. For example, a synthetic marijuana would have the same effect on you, or the same high, so to speak, as regular, real marijuana?
And that's actually not true.
Oh, really? Is that right?
So,
wow.
Yeah, designed to hopefully have the same effect. However, everyone's body chemistry is so different. A lot of times we see extreme agitation, almost like PCP, like Angel does, where people used to get superhuman strength and fight off four people trying to hold them down.
Yeah.
We're seeing that with K2, Spice, whatever you want to call it. It's probably a good time to talk about the nomenclature, the names of these things.
I think good, because K2 is something that's it's known on the street, I guess you could say, right?
Right.
So let's talk about some of those names.
So really at the end of the day, if you get down to the bottom of it, they're all synthetic cannabinoids. That's actually accurate. However, how you label them is different. They all come in different packages. So K2 actually was a brand name. And that's like saying I like to blow my nose with Kleenex.
Right, as opposed to tissue.
As opposed to tissue. But we're talking about tissue. This is synthetic cannabinoids, and they all have tons of names. And actually, you know, online, if you just Google synthetic cannabinoid, you will see they come in all different flavors and sizes. Some of them are sold as potpourri. And so that's not illegal, right? You can go to a gas station and buy potpourri.
It's not illegal for the purpose that it was intended for, right?
Perhaps, yeah. So there's a lot of different ways to get around this.
Yeah.
But if you go home and smoke it, you know, that's another issue.
Yes.
Which is what's done essentially. And so there's a lot of different names for it. When we talk about K2, it's the same thing as Spice. It's the same thing as Kush. There's a lot of different names for these things. And so a lot of times when people come into the ER, I ask them, do you remember what you smoked? Sometimes they'll give me a name, but at the end of the day, it's synthetic marijuana.
And there may be situations where they don't know what it was, right? They may think they know.
They may not. Someone might have given them something to smoke saying it was regular marijuana, and, you know, 6 hours later they wake up in the ER and they don't know what happened.
What do people want synthetic for? Is it simply because it's cheaper, or do they want a different experience, a different high, so to speak, just to try something new?
You know, that's a tricky question. I'm not quite sure. Occasionally I think it's really they just want to escape reality in whatever way they can. A lot of times when I meet people who do synthetic marijuana, they use other drugs too. So they're not usually novices, although, occasionally you might be exposed to that as, a teenager. But usually these folks have done other stuff and they are trying something new. And I don't know if it's maybe a legal issue where, it's difficult to test for these. You almost can't test for these.
You were talking about how law enforcement, how difficult it is to keep up with, identifying what it is. How does the medical profession keep up with it and constantly identify these things?
It's hard. You actually just go by experience. So when you see a rash of cases that comes into the ER, we do it with heroin too, actually, and we know when something is stronger than what it's used to be. We have our usual players that come into the ER for various issues, and honestly, we have the luxury of just asking them. A lot of times, these folks will tell you, I did this because...
Will they have a sample on them sometimes, or they used it all?
They're smarter than that, or they've used it, or a lot of times they've been changed into a gown and patted down. They don't really want to give us any samples, and sometimes the police are involved. So,
but if they use their brain, they would know that it actually could be helpful for their health if you actually could.
Yes, you could, and as I mentioned earlier, there was a gentleman who had used a substance called Nightmare. And I said, well, why would you smoke something called Nightmare when this is what happens to you in the end? He goes, that's a good point. But he actually gave me a specific brand name. And a lot of these have kind of funny brand names like that too. And but I think people just want to try different things. It is cheap. It's cheap. It's readily available. Until recently, you could get it down at the gas station around the corner. And technically, if you have the right chemical formula, it's not illegal yet.
Yeah,
and so,
but that's only a matter of time, right?
It's only a matter of time.
Where are we? Where do we stand in society, out in the street in general, as far as synthetic drugs? What's the most popular? Are they beginning to take off? Is there something synthetic that may take over something that's grown?
I don't know if I can answer that for sure, because
what are you seeing in your ER?
I see a good amount of heroin and K2.
Okay.
Less cocaine. Marijuana here and there, but you don't usually end up in the ER.
And obviously some of that's not synthetic, right?
Right. Some of that is good old-fashioned drugs that we're used to. And the other thing to remember is in the ER, we tend to see the folks that it didn't go so well for. Yeah. So we can't account for the folks who actually had a good experience with synthetic marijuana.
They're not coming in.
I would assume not. I think they're the ones who are doing it again. But what we find is a lot of this, we call it polysubstance abuse. It really is everything. People will mix, OxyContins, which you get either illegally or you get it prescribed to you, with alcohol, with synthetic marijuana, maybe some heroin here or there. I mean, the folks who use these things, they're professionals at trying to get a chemical mixture that gives them a good high that they like. And so sometimes whatever messes up that balance, similar to the fentanyl lacing of heroin for a while that was killing a lot of the drug users in the area, it took a while for them to catch up. We haven't seen so much of that recently. So it comes and goes in ebbs and flows, but also on off of I-95, we have so much access to whatever. It goes up and down from Boston to...
Yeah, we're right in the middle. Yeah.
Oh, we're right in the middle. It's easy to get. So I don't know necessarily where they're getting it from right now, and I know people are bringing it from New York City, and who knows, could be coming down from all sorts of places.
Is there a difference in... I know there's a difference in the type of high you would get if you smoke it versus eat it, in a food substance or something like that. Is that the case with synthetic too, or people have a preference of how they want to use it?
Most people smoke it. It's a faster high, quicker high.
So it's a different kind of high if you eat it in a brownie, to use that analogy.
I would think so, although I haven't met anyone who's eaten it, honestly. So maybe they're...
You're talking to a guy who likes food, so if I'm gonna, it's gonna be in a brownie. I'm gonna tell you that. So yeah. So on the street now, that you see, how about like the demographics? Kids, older people, obviously socioeconomical issues. Homeless and drug users. You're gonna see them too. But talk about that a little bit.
So as I mentioned before, probably a little more in the hardcore users of drugs. So you'll see it a good amount in the homeless population. So which makes me think it's got to be cheap, which is why they get that. It's readily accessible. I don't see it so much, at least firsthand, with teenagers, high school kids.
Are they aware of it?
I don't know. I can't say I've had a discussion with any one of them, nor have I seen one that really has been smoking K2, unless, honestly, that kid has smoked and done other stuff already. So, not necessarily a gateway drug. But, you do see it sometimes in the service members in the community, too. That may be an issue where they can't be tested for it. I think that's been a consideration. But also, even a couple of years ago, the military, Navy here, was onto it. They actually forbid their members from going to local gas stations that were selling these potpourri substances. So they saw this even early on. But it's actually probably not that hard to hide that you're high on synthetic marijuana because it's very agitating. You're not functional, and so it's something where I don't think you could actually be working and doing something without somebody questioning.
I mean,
you.
with real marijuana, it's more like you can kind of see it in their eyes,
Yeah.
smell it a little bit like
Yeah.
that, but mostly just in maybe a calmer demeanor,
Sure.
and that's about it.
Sure.
But you're talking about the synthetic stuff who really do weird things to you.
Right.
Yeah.
So we see people coming in where they are extremely agitated, where they are having multiple people hold them down because they can't help themselves. They're very paranoid. They see hallucinations. They injure themselves accidentally. They injure other people accidentally, healthcare workers. So we have a very high suspicion when someone comes in agitated to the ER. We even have the ambulance call ahead and go, hey, you know what, this guy might be doing synthetic marijuana. Be prepared because that's when you get all hands on deck. Because if you have just one person walking up to that guy, he could be sleeping. Next minute, punch you in the face.
And so this is you've got to have a full staff, I would imagine, right?
Yes.
And not the easiest thing in the world to identify, but like you said, I mean, even just having a conversation with them. How long does it take? I guess it depends on the drug itself, but is there a time period before they come down, before you can
a while.
Rationally have a conversation?
I would say at least 6 to 8 hours.
All right.
It's usually an overnight.
It's almost like being in the drunk tank, so to speak.
Yeah,
You know?
yeah, being very drunk and being in
Yeah.
a drunk tank. Yeah. So it takes a while, and honestly, a lot of times when you come in and you're that agitated and a danger to yourself or others, we have to give you some medicine to make you safe.
A sedative kind of a thing.
Yeah, and then you actually sleep that off. And so, yeah, usually it's a while, and then they wake up and they're, essentially.
I was going to ask you, what is their mood? What is the persona like? Is it like nothing ever happened, or?
Sometimes they don't remember what happened at all.
Okay.
Yeah, so they usually actually, when they don't have the drug in them, they're actually quite normal people.
If anybody knows about it, it's you. But how, in the industry in general, the medical field, how tough is it to keep up with it? Are you always have to learn something new? We talked about the law enforcement aspect. What about the medical aspects?
I think you read, the up-to-date papers that are coming out. However, as I mentioned before, the chemistry behind it is changing so quickly. We actually looked at toxicology literature, but it's so hard to pinpoint what exact chemical is going on here. And the tests for it are so expensive that honestly they can only be done at large government institutions. And so there's a lag, and I can guarantee you the people that are making the drug are way ahead of the detection of the drug. And so a lot of times you don't know what is out there, except you can say, this person looks like they're on synthetic marijuana. This is how we typically treat it, and you wouldn't be wrong in treating it that way. So someone who's extremely agitated, whether they're on angel dust or synthetic marijuana, or methamphetamine, frankly, the treatment is the same from our standpoint, which is
The detox aspect of it?
well, you make sure they're safe. You give them medicines to calm them down if you don't think they're safe, and you treat the side effects of it because there's no reversal agent for these things. So there's nothing you can really do other than take care of them, and so that's pretty straightforward. And then you wait for their body to metabolize whatever they did, and if you're lucky, they'll tell you what they did. If you're unlucky, you may never know.
You ever discover that it's an eye-opening experience for one of them, and it's like their scared straight moment?
Yes.
Yeah, that's good.
Yes.
At least there's some happy endings to some of these stories.
Well,
right?
it's a teachable moment is what we call it. So, you basically look them in the eye and go, did you enjoy that high? And the answer is no. I mean, they're strapped down and, they might have bruise marks from whatever they did, when they were high, and they ended up in the ER, and it's not the best place to be, so.
Unfortunately, you mentioned that you have some regulars that come in, so that there's a group of individuals that do not get the message and are,
No.
they're habitual about it.
Right. Well, it is addictive too.
Yeah.
It can be addictive. So that's something that, interesting enough, has been discussed as regular marijuana. As is that addictive or is that not addictive? There's
What's
a
your
camp
answer to that
thinks-
question?
I think it depends on who you are.
Okay.
So some people could it be chemically addictive? Probably not, but psychologically addictive? Yeah.
How do
very
you
much
feel about
so.
the medicinal effects, the positive medicinal effects of it?
I think there's a role for it.
Okay.
And I think it's good that you have physicians actually prescribing it who know that, at stage 4 cancer, if you have nausea that cannot be stopped, marijuana, there is a role for it. And I think there's better regulation too, so you know what you're getting, where before you would just buy whatever you could get. Frankly, now they have marijuana farms that actually grow, testable marijuana with a certain amount of cannabis in it or THC. And so it's almost like a medicine, which honestly synthetic marijuana is not there. Not to say I don't even think there's a role for it, frankly, anywhere in medicine.
I was going to ask you how you feel about the boom in the cannabis trade, so to speak, even for recreational purposes, never mind medicinal purposes, which
Yeah.
is sort of where it was supposed to start,
Right.
and end, but it didn't.
Yeah, it's a slippery slope.
It's a very political, sociological one,
Exactly.
too.
Do you want to tax it, or
Yeah.
what's the next step there? I don't know. I think I would stand behind what I said about the medicinal purposes of regular marijuana. That there is a role for it, and if it's regulated, it's probably better, or at least you're getting better treatment than if you were getting unregulated marijuana from whomever. So.
We're going to go to a break. Is there a website people can go and learn a little bit more about what we've been talking about today? Where would be the best place for them to go?
It's tough with synthetic marijuana. There is no website.
Maybe just Google?
If you Googled synthetic marijuana, you could at least see what packaging looks like. So if you were wondering if a family member was using this into this, if you found an odd-looking package, you could say, this looks equivalent to something I saw online, because they come in small packages, little cellophane wraps sometimes too. So no distinct website, but.
Dr. Mayorga is a chairman of emergency medicine at L&M Hospital, and we learned a lot, but we have a lot more to get to. So we'll take a short break and come right back. I'm Sean Murphy. This is For the Record. Stay with us. Welcome back to For the Record. I'm Sean Murphy. I am chatting with Dr. Mayorga. He is chairman of emergency medicine at L&M Hospital. What does that title mean? You're the chairman. What does that mean exactly? You boss people around?
Yeah, no, I get outpatient complaints.
Okay.
Everything rolls uphill to me. No, honestly, what it means is I oversee operations, at least from the provider standpoint, for Lawrence Memorial here in New London, the Groton ER, and also to some degree Westerly as well too. So we try to even things out so we meet the standard of care appropriately at all places, and we share ideas, and that's what I try to do.
So you're in the emergency room per se? Or, okay.
Yes.
So is the emergency room still badly abused as far as people using that as their default, like general practitioner as opposed to where they should go?
To some degree. It's
Yeah.
tricky. It's actually an interesting answer to the question. It depends on who you are, because if the older way of thinking about it was, you shouldn't be here in the emergency room. Why are you here for your splinter or your toothache? But really, when you look at the individual, the patients, and you ask them, why are you here? Sometimes they're single mothers and they'd get fired from their job if they took off a single day from work, so they show up at 2 a.m. for their
Right,
sore
which
throat.
is the emergency room is the only thing open at that point.
Right. And so the other answer is there are not enough primary care physicians in the community, or providers, no advanced practice nurses. They can see patients too, physician's assistants. There just isn't. In all the United States, there's not enough. And so as it is, population is getting older. The baby
Living
boomer,
longer.
living longer, getting sicker. They're on more and more medicines, and so not only are we seeing sicker patients in the ER, but we also see people who are, we call ourselves the safety net for society, and unless you're proud to be that, you probably shouldn't work in the ER, because you'll burn out pretty quickly if you get angry at everybody who you think shouldn't be there.
And also, people who do have health insurance, if they don't realize that it probably costs them more to go to the ER as opposed to go to their general physician, right?
It certainly does, and actually healthcare is the #1 leading cause of bankruptcy, right? And so, trying to educate them on better places to go for various things, but in a responsible manner. It's tricky though, because some people will say, I'm having chest pain, but I didn't want to get my deductible was too high. I didn't go to, that's the wrong reason not to go to the ER.
Yeah.
So yeah, it's a work in progress.
So since we were talking about healthcare and earlier talking about synthetic drugs, you are on a very slippery slope as far as insurance companies willing to acknowledge this as a problem, willing to pay for it, and then that opens up another whole can of worms for doctors, for hospitals, for the insurance companies themselves, for the patients, for the people, right?
Sure. Right now, I think most insurance companies treat those that abuse synthetic marijuana as someone who abuses any other drug, alcohol, heroin. And there's probably something a little different that you need to do for folks that do that, but there's just not enough money in the system to actually focus on it. Most of these folks that use synthetic marijuana are not that functional. As I said before, you can't really work while using this stuff, and so they end up falling between the cracks in society and being left to just deal with whatever happens on their own. So the testing for it too, we had talked about this prior, it's expensive. This isn't an easy test. They keep changing the chemicals behind this, and so to develop a machine that actually tests for this chemical that all of a sudden is now out of date, no one is willing to spend the money to develop that machine, and so there is not great testing except at the large national level, maybe the state level with government funding.
And whenever you say money, if you're talking about a domino effect, if the pharmaceutical companies don't want to get involved in developing drugs because it's not financially viable for them, then you're going nowhere at that point, right?
Right. So you're left out there by yourself.
When will the nanoprobes? I like to see that. When's that going to happen?
I think next year, hopefully.
Oh, is that right?
It's coming down.
That close? Wow.
Did you get the memo?
I'm going to save. I'm going to save an appointment until then.
Okay.
We talked about a lot about drugs. Let's get back to real stuff for a second. Heroin is an issue. It's a big issue.
Yes.
I don't know. Is that number one right now? As far as drugs. We'll talk about alcohol in a bit.
I think substance abuse as a whole is number one of our challenges. There's many challenges. That's just one of them. But heroin is huge. We've been addressing it for the last 2 to 3 years. We've had a long history of heroin abuse in this part of the country. Honestly, it's very regional, depending on what you see. But we've had actually a spike in heroin abuse probably in 2013, 2014, really went up. And we're not entirely sure why that happened. Some of it was more potent heroin because it was laced with fentanyl. Sometimes it was just a stronger form of heroin. So we would go periods where we'd have multiple overdoses, multiple deaths. And sometimes you could ask these folks, was there a new supplier? Did you use something different? Because many of these folks actually are used to using the same amount. A bundle here, a couple bundles there. They know how much they can tolerate. And all of a sudden, when they're not breathing anymore and they thought they used the same amount, something changed. So.
And something that people don't think is a problem until it's too late, and it's the average Joe too, is prescription drugs, right?
Right.
Talk about that a little bit.
Well, according to some of the government websites, prescription drugs actually killed more people than heroin.
Wow.
And this was in the last few years. And so it is a huge problem. The amount of prescription drugs that are flooding the market, that are traded out in college campuses, that are traded amongst drug users. They'll swallow it, they'll shoot it, they'll do all sorts, they'll snort it. And I'm talking about things like OxyContin, Dilaudid.
And that's a pain killer.
Those
right?
are opioid painkillers, exactly.
Strong.
And so, related to heroin, exactly. So those are used, and there's a good amount of evidence that says if you actually are exposed to those sooner on in life, you are more likely to try something like heroin or do something stronger and become addicted. And so it's something that we are actively trying to regulate ourselves because it's tricky. Most people that come to the ER, if you ask them what level pain they're in, they'll say 10 out of 10. That's the highest. Otherwise, why would I be here? And so we, as physicians, want to alleviate suffering. And so the natural inclination is, well, I can give you something for that. However, it's very difficult to tell if you really are a 10 out of 10 or are you just telling me you're a 10 out of 10 so you can get a Percocet. Very hard. So the state has actually instituted a prescription drug monitoring program where online now they actually track how many controlled substances an individual gets and by which provider, and actually at a certain point they'll flag you and say, hey, you are shopping around to different ERs getting different amounts of Percocets, and that's an issue.
With networking now, it's easy to track in. They can
Oh, yeah.
see if you're abusing it.
Exactly.
I don't want to end the show without letting alcohol escape our conversation because, that is right up there too.
Alcoholism is a huge part of what we see in the ED, and I think we've gotten so numb to it that we don't talk about it anymore. But it's a huge factor in the majority of traumas we see, especially in the summertime. It's not just a car accident; it's usually somebody who's drunk and they crash their car or they crash their bike or they try to do a flip into a pool and they missed because they were drunk. So responsible use of alcohol is something that we try to talk about. But also then there's the dependent alcoholics who they can't keep a job because they're always drinking. They spend all their money. They have liver failure now. It's a huge burden on society and healthcare. But we do have resources. We have locally SCAD in New London. We also have Stonington Institute out in Stonington. So we try our best. But those are residential programs.
Right.
What we hope to do is try to get people into programs like Alcoholics Anonymous, where you can actually still have your life, but try to drink responsibly or stop.
I'm almost certain that I have a caffeine addiction. What do I do? What should I do about that?
I don't know. Let me know when you know, because I have one too.
Because you could be rich if you do that.
Yeah.
And also, it is possible to ingest too much ibuprofen or acetaminophen at some point, right?
It can. You can actually
Mess around with your kidneys or something.
Acetaminophen is actually more life-threatening than ibuprofen. Usually with ibuprofen, if you take a whole lot of it, you might get an ulcer, you might bleed, or your kidneys might suffer
Ringing
a little
ears
bit.
or something?
That's more aspirin,
Okay.
I believe. But acetaminophen, your liver will shut down, and you will need a transplant.
Wow.
So yes, that's actually much more dangerous. So we actually consciously talk to our patients about the appropriate amount to take.
We learned a lot today. We got as much in as we could. Dr. Mayorga, the chairman of emergency medicine at L&M Hospital for our neck of the woods here in eastern Connecticut, southern Rhode Island, for Westerly Hospital. Thanks for coming in. We learned a lot.
Thank you.
You can see this show and many others on our YouTube site. Till next time, I'm Sean Murphy. This is For the Record. Take care.